When it comes to taking antidepressants, you have options. Perhaps one of the different kinds of medications, whether it's an SSRI, SNRI, can relieve your symptoms. What do these SSRIs, what do they do?
That essentially stands for Selective Serotonin Reuptake Inhibitors. It works by increasing the amount of serotonin, again, that chemical in the brain that helps regulate our mood, our emotions, and mental well-being. When serotonin is released through brain cells, it causes a signal to be sent, and then the brain sort of reabsorbs that. So this medication essentially stops that reabsorption, which means more serotonin is allowed to stay in that brain to help improve our mood and reduce those feelings of anxiety and help with depression. SSRIs are what our first line for depression, anxiety, and post-traumatic stress disorder. And they can also be beneficial as well for those suffering with OCD.
Let's switch over to another antidepressant, which are SNRIs. How are those different than the antidepressant we just talked about?
An SNRI, or a Serotonin-Norepinephrine Reuptake Inhibitor, these work really similar to our SSRIs, but they affect two chemicals in our brain instead of just one. Like an SSRI, an SNRI stops the brain from reabsorbing serotonin, but also blocks reuptake of norepinephrine, which is another chemical that plays a role in our mood, our motivation, and our energy levels. These are also first line as well for depression, and then they can also potentially be used for anxiety disorders as well as PTSD. But because of that norepinephrine component, we do just need to be a little bit more cautious because that is kind of our fight or fight response. So having too much norepinephrine could potentially worsen those anxiety or PTSD symptoms initially until our body kind of gets used to those new levels.
When it comes to SSRIs and SNRIs, are there specific side effects with both of them that kind of make them maybe better for somebody as opposed to the other one?
Most of all the antidepressant drug classes, they have pretty similar side effect profiles and are generally pretty well tolerated. Some of those more common side effects might include headache, trouble sleeping, and maybe some gastrointestinal side effects like nausea, vomiting, or diarrhea. But overall, again, these are pretty well tolerated and should generally improve over 1 to 2 weeks as somebody gets used to taking the medication.
Whenever you talk about two things that are similar, the first question everybody asks is which is better. So do we have an answer when it comes to these two types of antidepressants?
There are times to where it may take multiple trials of an antidepressant medication to really try to find the one that works best for somebody. But again, also giving it enough time and adequate dosing to make sure that these medications are given a fair trial to work.